Thank you very much, Mr. Chairman. Mr. Chairman, on Friday there was a White House event that we were at, a few of us, including the ranking member, marking the 20th anniversary of the Trafficking Victims Protection Act. I am the prime author of that bill. It has saved countless women and children and many men stuck in labor trafficking especially. And none of you have mentioned that. I do hope you will speak to that issue, because I do believe modern-day slavery is one of those heinous crimes. It is disproportionately focused on women, and I have met many women who have been trafficked. I've had hearings with trafficking victims, and they need our love, our concern, and they certainly need rescue. Secondly, according to the World Health Organization, between 2000 and 2017, the maternal mortality rate declined by 38% worldwide. And also, according to WHO, the majority of maternal deaths can be prevented if women give birth in hospitals or are attended to by skilled health personnel with access to emergency obstetric care. And Safe Blood is very much a part of that. I do believe that USAID has embarked, and this is part of PEPFAR as well, to try to provide a means to assist these women. Countries should have a plan, communities should have a plan, so that a woman is pregnant, particularly in the final 3 months of that child's life before birth, that she will be attended to by someone if there is a problem, so that we can dramatically continue to reduce maternal mortality. Let me also point out that PEPFAR was the brainchild, frankly, of George W. Bush. And this man over here, where is he now? Okay. My good friend and colleague, Henry Hyde, joined by Tom Lantos, in a bipartisan way, pushed through the PEPFAR legislation. And that has saved countless Africans and others from the horrible death due to that terrible disease called HIV/AIDS. Also malaria and the other issues that are attended to it, opportunistic infections as well, have been greatly mitigated. In 2018, I was the prime author of the reauthorization for 5 years of PEPFAR, joined by Barbara Lee and a group of bipartisan lawmakers, so that about $30 billion roughly will be authorized and hopefully appropriated to help those. Now, one of the points that is brought out that women represent the majority of those served by PEPFAR. ARV therapy, for example, 66%, or 9.8 million of those with ARV therapy were women. And I think that is a great thing that this policy is having such a positive impact. Now, on the Protecting Life and Global Health Assistance, that legislation, or that policy, I should say, is designed to ensure that U.S. taxpayers don't subsidize foreign, non-governmental organizations that perform or promote abortion as a method of family planning, and build on what was originally called the Mexico City policy created by Ronald Reagan. In 1985 and 84, I offered amendments on the floor to affirm the policy, and there was widespread statements made on the floor in debate that nobody will accept this. Well, the 6 months reviews found 99.5% of the people that we want to support accepted those pro-life guidelines. Let me also point out, the issue of abortion, we forget somebody when we talk about that. I do believe we need to care for both. We need to love both, mother and baby, and do everything humanly possible to ensure that there's a safe delivery. I'm the author of the Pain-Capable Unborn Child Protection Act. We know beyond any reasonable doubt that unborn children feel pain at least from the 20th week on, and maybe even earlier. And because of prenatal surgeries, children ought to be seen as another patient. The unborn child, the other patient, along with the mother when they present to a healthcare professional. So the Abby Johnson, some of you may have read her book, maybe not, maybe this panel has or hasn't, but she was a Planned Parenthood activist, ran a clinic, an abortion clinic in Texas for 8 years. When she assisted in an abortion, and this was the first where there was an ultrasound-guided abortion, she held the probe, and she saw that baby dismembered right before her eyes. She walked out the door and said, "I will never be a part of this again." Now she's a very articulate spokeswoman for the pro-life cause. Birth is an event that happens to all of us. It's not the beginning of life. Ultrasound has shattered the myth that somehow there's no baby there. So I would encourage you. Murtad Nathanson, the founder of NARAL, one of the 3 co-founders, he said, "I've come to the agonizing conclusion that I presided over 60,000 deaths." He wrote that in the New England Journal of Medicine and became a strong pro-lifer. Let's affirm them both. This policy affirms them both and says contraception, this doesn't cut it by $1. It says that who we support, not just what, matters. And if a group is trying to bring down pro-life laws in other countries or provide abortion, perform dismemberment or chemical poisoning abortions, we got to look at the fact, just like Abby Johnson did, and say, what actually happens in that abortion? A baby is dismembered, or a baby is killed. RU-46 first starves the baby to death, one of the chemicals, and the other provides an expulsion of the child from the womb. These children deserve better. Women deserve better. And, you know, I would ask Mr. Malumba, you know, do you know what the 3 exceptions are to the Protecting Life and Global Health Assistance are? Because you turned down the policy.
Thank you, sir, for the question. My expertise is on the implications of the policy back home.
So you don't know the 3 exceptions. I'm really out of time, so I want to. The exceptions are rape, incest, and life of the mother. We don't want family planning abortions, and that's what the policy, starting with Ronald Reagan, was designed to ensure.
Okay.